So this past week into this week, I really threw a curveball at most of my staff and the professionals within my organization when I told them we're going to move stuff from one side of the building to the other side and totally change the way we do things. And so, as you might imagine, at first there's a little bit of resistance because everybody's like, why are we changing something when things are working so well already? But my commitment is always to making things better. And I saw some opportunities where we can incorporate some of the magnetic field therapies into some of the exercise regimens. So think of it as instead of doing one thing and then doing another thing, and maybe that takes you 2 hours of total time, imagine if we could integrate those two things. Now you can be done in an hour. So it's better for people because, most people want to kind of get in, get results and leave. They don't want to like sleep overnight and stay forever. They want, once they start feeling good, they want results as fast as possible. But from a perspective of time management as well, you want people to feel good sooner versus later. And so what I did is I brought over a number of laser systems and electrical systems and magnetic field therapies. I actually set them all up in the gym. So in a lot of ways, it looks more like almost like a physical therapy center than more like a cancer treatment center in that regard. And imagine now as people are working out, we brought in special straps that we could attach like these giant magnetic pads to their torso. So their spine could be receiving magnetic energy while they're doing an exercise. Or one of the doctors could be doing a certain laser therapy while they're moving. And the whole idea behind this is to first help people get stronger, because once people can feel a difference in their body, it gives them a sense of hope, like, hey, this is working and I'm going in the right direction. And maybe more importantly, to a certain degree, it gives them a level of functional independence that they have not had in some cases for years. We have right now an 84-year-old woman who, when she walked in the door, it took both of her children to help her. She could not walk on her own. She was pretty bent over. And now she's walking independently. She smiles all the time and she tells everybody how much she loves everyone at the building, But when the family first started, they're like, what are you going to do for our mom? She's in really rough shape. And I'm like, well, we're going to do everything we can. We don't know the exact answers until we see how she responds. But if you give us a little bit of time, I think you'll be happy. And the family is now, we get to see this 84-year-old woman and 4 of her children. I guess there's an in-law or 2 in there as well, but almost every day. And they love it there. And so we want that same type of relationship with everyone that we help.